Assalamu alaikum. I'm Saira Khalid, roll number 158 from batch 29. We'll be presenting our research on attitudes of people towards COVID-19 booster dose, a systematic review conducted under the supervision of Dr. Fariha Salman in Department of Community Medicine, KEMU Lahore. First up will be the introduction presented by roll number 304.
Assalamu alaikum. My name is Umair Mahboob, roll number 304, and I'm going to present the introduction. COVID-19 is a highly transmissible viral illness caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, which caused approximately 3.8 million deaths worldwide. Vaccinations are the most effective medical interventions for control of infection. By September 2020, 4 COVID-19 vaccines had been authorized by WHO for emergency uses. According to latest data, 18 COVID-19 vaccines are approved and currently used worldwide. Boosters. After the development of initial vaccination course, booster doses have been developed for further protection against new and ever-existing mutant strains. Still, a large population remains resistant and hesitant towards the vaccines, especially the boosters. Booster dose rejection occurred for varied reasons, such as lack of confidence in government, doctors, pharmaceutical companies, and the product itself. In addition, vague and incomplete information contradicting official recommendations and vaccine safety and effectiveness issues. Fear of side effects also made people hesitant. Religious and cultural beliefs, conspiracy theories, and political affiliation have also led to the spread of misinformation. While booster dose acceptance was mainly aimed at acquiring additional protection, family health, community health, and patients' health protection.
Now objectives will be presented by roll number 160. Okay, the aim of this review was to assess attitudes of people regarding COVID-19 booster doses, including reasons for acceptance or hesitance. For this purpose, articles were assessed from various reliable sites, including PubMed, Google Scholar, and NDPI. Search yielded a total of 116 articles, and after screening, a total of 28 articles were included in this review. Next, methods will be presented by roll number 162. Methods will be presented by roll number 162. The research strategy, papers published in PubMed, Google Scholar, MDPI assessing COVID-19 booster vaccine hesitancy, vaccine uptake, and vaccine acceptance were eligible for inclusion in this review. Keywords used in our research were hesitancy, acceptance, restraints, and booster dose. Study selection. Only those studies which were in English language that met the inclusion criteria were considered. The inclusion criteria involved the following things. Number one, studies that provided data regarding COVID-19 booster acceptance among people both before and after getting fully vaccinated. Number two, studies pertaining to general population, healthcare workers, minority and religious community students or patients. Number three, studies on all types of COVID vaccine booster dose shall be included in this review. And number four, studies with cross-sectional case control and cohort designs published in English language from 2021 to 2022 will be included. Now coming to the exclusion criteria, case reports, series, conference papers, proceedings shall be excluded. Articles available only in extract form, editorial reviews, letters of communications, commentaries, and gray literature will be excluded, and articles in any other language than English will also be excluded. Next up, under is by roll number 159 and 158.
Assalamu alaikum. My name is Zahra Tanveer, roll number 159. I will be presenting first half of the research results. A total of 116 studies were obtained using 3 search engines, MDPI, PubMed, and Google Scholar. According to PRISMA guidelines, the articles obtained after screening by applying exclusion and inclusion criteria were 28. So 28 articles were included in this systematic review. Characteristics of the paper included in this review. The study is composed of surveys on data about attitudes of public towards COVID-19 booster dose acceptance from 22 different countries. Most of the surveys were conducted on USA with a total of 6, followed by China with a total of 5. Dates of surveys ranged from April 2020 to March 2022. According to sample size, the largest survey was conducted in Denmark with a population size of 31,721, while the smallest was among the ones conducted in USA with a population size of 501. Generally, 19 surveys were conducted on general population, 1 on factory workers, 1 on medical students, 3 on healthcare workers, 3 on university students and employees, and 1 on child caregivers.
I, Saira Khalid, roll number 158, will be presenting the rest of the results, starting with the rates of COVID-19 booster acceptance worldwide. So, in the studies conducted upon the general population, the highest booster dose acceptance rates, which was said to be above 90%, were found in 3 studies. Firstly, from Fukushima, Japan, with a rate of 97.9%, followed by China, 93.7%, and lastly, UK, 92.3%. The lowest booster acceptance rates, which were defined by having a rate less than 60%, were found in 5 studies from Indonesia 56.3%, followed by USA 53%, Algeria 51%, Jordan 44%, and Malaysia 43%. Here we have a graphical representation of the booster acceptance rate worldwide. As we can see, the highest rates are in Japan, while the lowest are in Malaysia, shown by the first bar. Then we have the studies conducted among specifically university community. Booster acceptance rate were greater than 70% overall, with the highest being in Germany, 87.8%, followed by Italy, 85.7%, and UAE, 77%. The remaining 3 studies were conducted exclusively on healthcare workers, with the highest acceptance rate found in USA of 92.1%, followed by Singapore, 73.8%, and Czech Republic, 71.3%. This is the geomap showing the booster acceptance rate worldwide. And as we can see, the East Asian and European region have the highest acceptance rate, while moderate acceptance rate are present in America. The studies from South Asia and Middle East were inadequate to formulate any pattern, as well as from Australia and South America. Next discussion will be presented by roll number 305, 306, and 308 respectively.
Discussion is presented by roll number 305. To combat different variants of SARS coronavirus 2 vaccine followed by boosters were adapted. This posed a great challenge for authorities to convince public to receive booster doses. Booster hesitancy has been one of the major hindrances in way of successful completion of national vaccination programs worldwide. Therefore, estimates of booster vaccine acceptance rate and understanding the general attitude of public will be crucial in alleviating the aforementioned problem. Our review, including 28 global studies, after thorough screening of PubMed, Google Scholar, and MBBS, shows following points. Vaccine acceptance rates were generally higher than 90% in East Asia, 2 surveys from China and 1 from Fukushima, Japan, and fairly higher than 80% in European states, UK, Denmark, Germany, Italy, Spain, Austria, and Switzerland. Data from South Asia, Africa, and Middle East was inadequate to formulate any recognizable pattern. Sex and age were found the leading correlation.
Assalamu alaikum. I am roll number 306. I will be continuing the discussion. A total of 10 studies showed higher acceptance in males, while 7 indicated higher acceptance in female population. The most common explanation found for this pattern were related to psychological and hormonal characteristics of females, including increased risk perception. In regard to age, 14 studies correlated higher booster dose acceptance with increasing age. This can be related to the fact that elderly people are among the prioritized group for booster administration. Only 4 of the total studies found higher booster acceptance in younger population, while the rest of the studies failed to provide any correlation with sex and age. Thank you.
Assalamu alaikum. My name is Zaur Rahman and my roll number is 308. I will be doing rest of the discussion. Basically, in those countries where multiple studies were organized throughout the years 2020 and 2021, we were able to formulate a pattern, a graphical pattern to show the vaccine acceptance rate throughout the time. Such as in the United States, as we see, the acceptance rate was initially low, 53% in April 2020, but gradually it increased, basically due to government restrictions or other factors, and it was 92% in February, March 2021, and then when 69.6% in July 2021. 58.3% in October 2021, and 70.2% in January 2022. On the other hand, when we see in China, there is a relatively higher acceptance rate. There is no higher dip in the acceptance rate. It ranges from 91.6% in August 2021 to 76.8% in October 2021, and then it again increased in November 2021 to 93.7%.
Limitations will be presented by roll number 307.
Assalamu alaikum. My name is Ishan Kamal, roll number 307. I will be discussing the limitations in our study. The first one was a dependence on the few search engines, which were PubMed, MDPI, and Google Scholar. Some important studies might have been missed, even though we were able to yield 116 articles initially, and after the screening process, we were left with 28 articles to include in the review. Furthermore, this study included many cross-sectional studies and online surveys with different sample sizes involving bias, such as selection bias, volunteer bias, and self-report bias, which might have distorted the results. Another limitation was that in most studies, acceptance was measured by self-reports without any scale. There was another self-selection bias in in most of the studies that they were carried online, and people without smartphones won't have responded to the surveys, limiting the accuracy of the results. Furthermore, even though a number of factors such as age and gender were considered in relation to the attitudes of the people, not many studies collected information about the occupations of the people involved. So we cannot say anything about the relation of occupation and attitude of the people towards the booster doses.
Lastly, conclusions will be presented by roll number 161.
Assalamu alaikum. I'm Zainab Aziz, roll number 161. I'll be presenting conclusion of our study. Vaccine acceptance rate is higher, greater than 90% among East Asian countries as indicated by studies in China and Japan. European countries also have significantly high vaccine acceptance rate, but data from South Asia and Middle Eastern countries was inadequate to formulate any recognizable pattern. The acceptance of vaccine booster was more among males and aged persons. Vaccine hesitancy is one of the biggest obstacles in the way of achieving control over the pandemic. There should be proper coordination among the government, healthcare workers, and social media to lessen the hesitancy for vaccine among the public and make them aware about the effectiveness of vaccine boosters. Thank you, ma'am. That is all.